Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be looking at the median nerve injuries. So let's look at the median nerve and its injuries. So the first part is it is divided into the high lesion and the low lesion. So now let's understand what is the high lesion. So high lesion. So this high lesion is the cause being, it is at the high lesion means it is at the level of the elbow, and the cause is it is the supracondylar humerus fracture. Supracondylar humerus fracture. Next, moving on with the motor manifestations. This includes, there is thenar wasting. There is also the ape-thumb deformity. Importantly, there is a pointing index. As well as benediction. Next, there is also the Pope or Ochsner's clasp sign. Ochsner clasp sign. Now moving ahead with these are the motor manifestations. So another point being there is the Kilonevin sign. Kilonevin sign is nothing but a weak OK sign. It is due to the injury of it is a weak OK sign. Weak OK sign, and it is due to the injury of the AIN, anterior interosseous nerve. It is a pure motor branch of the median nerve supplying the FPL. So it supplies the FPL and also the lateral half of the FDP. Lateral half of the FDP. Now moving on to the motor loss. The motor loss, it includes the loss of pronation of the forearm. So loss of, first one being pronation, and pronation is nothing but of the forearm. And also there is loss of flexion. Loss of flexion. And there is loss of flexion of the wrist, flexion of the forearm, the wrist. Next, also the flexion of the DIP, the PIP, as well as the MCP joints of the index and the middle fingers, or the index and the middle fingers. Next is, there is also the abduction of the thumb. There is abduction of the thumb, and there is the pen test being positive. Pen test is nothing but it is positive. Next, the loss of the flexion of the thumb and opposition of the thumb as well. So the flexion as well as the opposition of the thumb is lost. Now let's move on to the sensory part. So what is meant by the sensory loss? Sensory loss is over the palmar aspect. So this is nothing but over the palmar aspect, and this is involves the lateral 3.5 fingers as well as the thenar eminence. Now let's quickly recap only the important points. So the high lesion, it involves the elbow. Next, the motor manifestation, important being there is a pointing index. Pointing index is also known as benediction, and the Pope or the Ochsner clasp sign, OC sign, and there is also the Kilonevin sign, that is nothing but OK sign. Next, there is loss mainly of the pronation of the forearm. So pronation of the forearm as well as the flexion of the flexion, and this is of the forearm as well, and the wrist. The flexion of the DIP, PIP and the MCP is also lost. There is a flexion of the thumb, opposition of the thumb and the abduction of the thumb, all are lost. And sensory loss is over the palmar aspect of the lateral 3.5 fingers. So palmar aspect of sensory loss over the lateral 3.5 fingers. Also in the thenar eminence. Now moving on to the lower lesions of the wrist. So under the lower lesion of the wrist, lower lesion is nothing but involving the wrist. So the cause being the carpal tunnel syndrome. Carpal tunnel syndrome. So what are the motor manifestations here? The motor manifestation is it includes the thenar wasting. Next is there is a ape thumb deformity as well as the Kilo-Nevin sign. Then moving on to the motor loss. This was about the motor manifestation. Now the motor loss is there is a loss of abduction of the thumb, flexion of the thumb and the opposition of the thumb. So thumb, as we discussed, it includes the abduction, flexion as well as the opposition of the thumb. They are all lost. So abduction of the thumb is tested with a pen test. Next is what about the sensory loss? So we are talking about the low lesions in the wrist, and the sensory loss is there is over the palmar aspect of, so there is, it is over the palmar aspect. So this is over the palmar aspect and it's intact in the carpal tunnel syndrome, and it lays intact in the carpal tunnel syndrome and lateral 3.5 fingers only. So there is sensory loss over the lateral 3.5 fingers only. Now let's quickly recap the lower region, that is the wrist. So the important points being the cause of the lower region at the wrist is that it involves mainly the carpal tunnel, main cause being the carpal CTS, carpal tunnel syndrome, motor manifestation, thenar wasting, ape thumb deformity, as well as the Kilo-Nevin sign. Next, there is loss of the thumb. In thumb, we have abduction, flexion, and the opposition is lost. And the sensory loss is over the palmar aspect, that is intact carpal tunnel syndrome of the lateral 3.5 fingers. So 3.5 laterally, the sensory loss is seen. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.